Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Today, we're going to talk about a topic that was requested by some teachers when I posted in a Facebook group a while back, a couple months ago, sort of saying, are there any topics that you're interested in learning more about? I'll try and cover them over the next few months in the podcast. And one of the things that came up that a few teachers sort of commented on and were interested in was a podcast on sort of continuing education options for teachers, or just like avenues to continue furthering their education. So this was a topic that's sort of been in the back of my head for a little while, but I hadn't gotten around to sitting down and recording anything about it. And then this past weekend, I was teaching one of my continuing education courses, so the Savvy Dance Teacher course, that ran over this past weekend in Nanaimo with such a fabulous group of teachers. This course is one of my favorite courses to teach because it's a little bit of everything. It covers tons of different topics. It's all about applied dance science. So it, is really kind of runs the gamut of lots of different things from covering like training loads and periodization and recovery for dancers and functional screening and strength and mobility and all sorts of different stuff. Anyway, that kind of triggered my memory that, people had requested this podcast topic as I was kind of teaching continuing education. And so I decided that that was what today's podcast episode is going to be about. So I will preface this by saying there are literally like endless options and opportunities for continuing education for dance teachers specifically. I am going to focus more so on things that are related a little bit to like dance science or dance medicine, dancer health and wellness, like those types of things. And this is by no means an exhaustive list. I just want to give you an idea of some of the things that are out there that maybe you may not be aware of, especially as a dance teacher. But also, I get questions all the time, especially on social media through like Instagram, people DMing me asking about education options for healthcare providers. So for physios, it's often newer grads or even physio students who are looking to get into the dance world and looking to find courses or find education opportunities that will help them become a dance-specific practitioner. So some of the courses or the things I'm going to talk about today are things that I did as a newer physio, or some of the stuff, it was all sort of once I was a physio. So the suggestions in today's episode are going to be appropriate for dance teachers, but also for healthcare practitioners. And I think a lot of times dance teachers ask for healthcare providers, and especially physios, ask for recommendations of like physio-specific courses that are like dance medicine courses. And those do exist, and there are some of those. But I always encourage healthcare providers to also consider taking courses that are meant more for just dance teachers, so things within the dance community. Because I think when you go and take those courses with the lens of whatever your professional background is, whether that be physio or chiro or whatever, you can really start to make connections and sort of see the applicability to your clinical caseload from a lens that's maybe not just somebody's telling you, like, this is the technique that you should use. I think you have to kind of like read around the edges, or as one of my mentors always says, listen around the edges and sort of be a little bit more critical in your application of that information, but I actually think that that is one of the best ways to learn. And so certainly, especially early on in my career, but even now, some of the courses I participate in or conferences I go to and stuff are geared more towards the dance community. And then I can come to those with a lens of, okay, how does this apply to like my clinical population, or how does this apply in a more dance medicine setting? So this episode is applicable to, like I said, dance teachers for sure, but also healthcare providers or people who are interested in getting into dance-specific healthcare and things like that. I'm just going to give you some ideas of some of the stuff that is out there. Also, before I get into my list of some of the recommendations that I have, I also want to say, and I've talked about this on previous episodes before, in terms of the lack of regulation within the dance industry. And if you're not sort of don't really know what I'm talking about, I will link a previous podcast episode about regulation within the dance industry. And so one of the things that is a consequence of the lack of regulation within the dance industry is that continuing professional development is not a requirement for dance teachers. So certainly teachers who are certified through certain governing bodies, so I'll just use RAD as an example because it's one of the bigger ones, teachers who have a teaching qualification through the RAD are actually required to have continuing professional development. And so that is just one of the reasons why having teaching qualifications is, or I guess, if you're looking for a teacher, like if you're a parent or something like that, looking for a teacher who has a teaching qualification should be one of the things that you're sort of looking for or aware of. And that is just one of the reasons why, because they are actually required to continue to take courses and continue to educate themselves and continue to sort of stay current. Whereas if a teacher doesn't have some sort of a teaching qualification, and there's lots of teachers out there who don't, there's nothing keeping them accountable to that. Now, that's not to say that those teachers aren't also taking courses, because a lot of them are, but you just don't know because there is no sort of accountability for that. So just something to think about in terms of, like we've talked about on this podcast before, the lack of regulation within the dance industry also then means that there is a lack of standardization when it comes to continuing education. I truly believe that as educators, so people who are providing education within their profession, so whether that be a dance teacher or a healthcare provider, because really most of what we do is provide education to our clientele as well. I truly, truly believe that anybody who is within a profession that education is a part of, that you should continually be increasing and continuing your own personal education as well. I think as educators, we can't continue to be our best and be at the top of our game unless we are also continuing to stay current and, learn new information and think about things from a different lens and all of that. I find it really interesting because, like I said, I teach these continuing education courses for dance teachers, and the teachers who come on to these courses for the most part are oftentimes the most experienced or very experienced teachers. Some of that is maybe because some of those teachers do have the teaching qualifications that require them to have continuing professional development. But I also just think that some of these teachers who are at the top of their game and have been doing it for a really long time, they've taken every course under the sun. They've done every certification. They're like what I would consider in some cases like master teachers. Some of them have been teaching for 30 or 40 years, and they are still the teachers who are signing up for these continuing education courses that I offer. And I always find it really interesting because there's, oftentimes not as many like newer, younger teachers or teachers earlier in their career. There's definitely some, but there's often not as many. And sometimes I wonder, how we can encourage more of those teachers to continue or to get started on their continuing education journey. So anyway, that was a bit of a rambly way of saying that I really truly feel that everybody, and this goes for healthcare practitioners as well, not just teachers, everybody should be continually upping their game and continuing to expose themselves and continuing to participate in professional development, even if it is not required by some sort of external agency or governing body. I know that, especially in the dance world, cost can often be a limitation or a prohibiting factor in terms of accessing some of these like resources. So I will highlight organizations that have free things as well. One of the greatest things I think that has come out of the explosion of availability of online stuff is that we don't necessarily have to incur travel costs to be able to participate in courses and workshops and things like that anymore. There's so many things being offered online. That's not to say that there isn't also value in participating in things in person, because I think there is, but that doesn't always have to be such a big barrier nowadays. And then also, there's more either low cost or free things available now as well. So maybe low cost is like a one-off webinar or a one-off workshop or things like that. And then there are definitely free things as well. So I think it is much, much easier for people to access these resources now than it used to be, when courses were maybe only offered as an in-person course and you would have to travel potentially long distances, like especially if you were with like a specific governing body and you had to travel to their headquarters for courses and things like that. Like it really was, and still is in those cases, cost prohibitive for a lot of teachers to participate. So I love that there's so many more options for people nowadays. I will also say there are literally endless options when we think about continuing education for dance teacher that fall more within like the dance realm. And I'm not going to touch on those ones today, but those would be things like potentially pursuing like a teaching qualification or certifications within specific niches within the dance world. So maybe it's like an acrobatic art certification or something like that. There's lots of options for continuing education for things in like pedagogy or choreography or more creative aspects of teaching, and those absolutely have so much value. I'm not going to touch on those today. I will not pretend to know everything that is out there from that perspective. I'm going to give you some suggestions just of things that I'm aware of from the more dance medicine or dance science side of the lens. So again, I'm not pretending that this is anywhere near an exhaustive list of anything, but I just want to highlight some things that are available. So with that, all my preamble finished, let's get into some examples and recommendations. I realize if you're listening to this, especially if you're like commuting or something like that, you may not be able to write any of this down. I will link all of the things that I talk about. I will link them all in the show notes. So you can come back and use this as a reference, and I will have links to the websites for these organizations so that you can find these courses easily. I am going to start off by plugging my own stuff. I often don't talk a lot about sort of what I offer or things that I have available from an education perspective. You know, a couple of times a year, right before I'm running a course, I'll kind of like promote it or talk about it in that regard. But I'm maybe not as good as I should be about promoting my own services and offerings. So I am going to take a minute just to plug my own stuff right now. So like I mentioned before, I do teach a course that is a 2-day course. I've taught it only as an in-person course so far. A lot of people have asked about turning it into an online course, and I haven't done that yet. It is not out of the realm of possibilities. I don't know if there's enough demand for it. So if it's something that you would be interested in as an online course, send me a message and let me know. If there is demand for it, I may consider doing it, but it is a lot of work to turn an in-person course into an online course. So I don't want to put in all that effort if there's not people interested in it as an online course. But the Savvy Dance Teacher is an applied dance science course. It is a 2-day course. It works really well teaching it in person. It's a really fun course to teach because there's a lot of practical applications. It's all about taking current trends in dance science. So we cover, like I said before, things like training load, recovery, periodization, all sorts of different concepts within the realm of dance science, and make them really practical and applicable for teachers to be able to implement in their studio immediately. A lot of the practical aspects are looking at functional movement assessments and looking at functional strength assessments, and then talking about mobility and looking at factors that could be influencing our dancers' mobility and ways to improve that. There's all sorts of practical kind of components in the course. So that's one of the courses that I offer. That's kind of my like biggest, most robust course. And like I said, it's like a 2-day kind of in-person course. I also have a online course that is just a flexibility course. So looking at, it's called Flexibility Foundations, and it is looking at specifically the nervous system and how the nervous system impacts our mobility. And so it's a course where we're learning how to like kind of harness the power of the nervous system to help our dancers improve their mobility in a way that is really safe and is like honoring the body and really making sure the body feels safe enough, or the nervous system feels safe enough to allow us to access our mobility or flexibility. So this is an online course. It's currently 4 weeks online. So there's like live sessions over Zoom, or they're recorded if people can't come live. And then resources that are available like outside of those live sessions as well. I'm just actually in the process of registration for the second round of it. So if you're listening to this podcast on the day it comes out, which I can't actually remember what the date is, but in August, if you're listening to it, registration is actually currently open, but only for 2 more days for the next round. So the next round, or the next cohort of this course, starts September 4th. So if you're at all interested in flexibility stuff, you have essentially 2 days left to register for this course that starts on September 4th, but I will run more cohorts of it in the future. So you can also go to the website and put yourself on like the interest list, and then you'll get all the information when there's another round of it running. So those are kind of my 2 bigger like signature courses, but I also have loads of other resources available on my website. One of the other things that I have that I never talk about, but I really probably should, is I have a like a pre-point assessment toolkit available for teachers. So this is an evidence-based assessment to tell if your dancers, like an objective way of telling if your dancers are ready to progress to point work. So there's a bunch of different like tasks that we do or tests that we use to determine when dancers are ready, functionally ready to progress to point. And so the point assessment toolkit gives you all of those tests, kind of the background on the test, little video instructions of the test, and then there's like evaluation sheets that you can print out and use and all of that kind of stuff. So that's, just something else that's available that, like I said, I never really talk about it. It's been there for a while. And people are definitely using it, and I just like don't remember to talk about it that often. I also have tons of webinar recordings on my website. And so a lot of these ones are free. I think one of them is a paid one on periodization, but the rest of them are free. And so I have ones on just, managing injuries in a studio setting. I actually have a pre-point assessment one as well. That's not like the actual tasks necessarily, but just, what is a pre-point assessment? Why would we use them? That type of information. I have ones about just common dance injuries, things that we see. So lots of different resources like that available on the website. So if you're at all interested in that, I will, like I said, link it in the show notes so you can just easily get to the part of the website that has all of the information for dance teachers, specifically in terms of continuing education. Although there are definitely lots of physios and stuff who do participate in courses as well. So it doesn't just have to be for dance teachers. All right, that's enough of talking about my own services. Let's get on to talking about some of the other ones that I recommend as well. I have talked on this podcast before about IADAMS, or the International Association for Dance Medicine and Science, and they are an excellent source of continuing education for dance teachers, for healthcare providers, for researchers, for all sorts of different people. Their biggest offering is their annual conference, which this year is happening in October in Italy. I will be there. I'm super excited. If any of you listening are planning on being there, send me a message. Let me know. Let's connect. I can't wait to meet lots of new people and then reconnect with lots of my old friends. So that is their biggest offering. There is a virtual component to it as well. So if you are not lucky enough to be traveling to Italy like I am for the conference in person, you can participate in it remotely as well. And I love this conference because It's really big and has many different kind of tracks going on at the same time. So there's usually, I would say, like 4 different sort of things going on at the same time for the most part. And one will be, potentially research-based things. So this might be academics from like research institutions who are presenting their latest research. Then there might be a track that's more kind of medicine related. And so maybe it's people talking about different surgical techniques or different case studies from rehabilitation of certain injuries or things like that. And then there's always movement sessions going on as well. And these are so awesome because some of them are being offered by healthcare providers. Some are being offered by, dance educators. Some of them are being offered by people more within like the yoga or Pilates or gyrotonic space or those types of things. And I always learn so much from the movement sessions. So there's something for everyone. Like it really is a conference that you see a lot of different people coming from different backgrounds, different dance backgrounds. And it's so nice because oftentimes conferences tend to be a bit segregated, like, it'll be a healthcare conference or it'll be a dance teacher conference. But this is very much like everybody in one space. And then there's different sessions that people can go to. So that's always a conference I recommend. IADMS also has other education opportunities as well. So it's not just their big annual conference. That is definitely their biggest offering. They do regional events. So, maybe once or twice a year, they might have a little mini day somewhere in the world. Like they'll do like a 1-day thing in Portugal, or I think they either just did or are doing something in Mexico as specifically for Spanish speaking members. So they're constantly doing things like that, like these little 1-day events. So if you keep an eye on their website, you'll see those, or better yet, if you get on their email list, then you'll be like emailed when these things are coming up. And they also offer some online kind of webinar-y type things periodically throughout the year as well. And a lot of times they're free for their members. Sometimes they have a nominal fee associated with them, but they're not super expensive. And the topics range hugely. They do a lot of work within the dance for health realm. So looking at dance as an intervention for different populations of people, whether it be like Parkinson's patients or things like that. So they just have a lot of different offerings. So IADMS would be one place to definitely start. And like I said, just get yourself on their email list if you want, and you'll kind of be notified of things, even if you don't want to become a member of the organization. Next on my list, similarly, I've also talked about this organization on the podcast before, Healthy Dancer Canada. Similar type organization to IADMS, but obviously national within Canada for us, bilingual as well. So offerings are in French and English, depending on what it is that's going on. And they also have an annual conference. This year, I am going to get the dates wrong, but it is, I want to say it's actually like the first weekend of December maybe, or right at the end of November. I can't remember what the dates are. It might even be like November 30th, December 1st or something like that. But anyway, it's coming up later this fall. It's in Calgary this year. But it also will have an option for virtual participation. So if you are not in Canada or can't get to Calgary, there is an option for virtual participation. This conference is great because it's way smaller in scale than IADMS is. And so it's such a great way of meeting people and networking and really getting a chance to like talk to all the presenters and get to know their work really well. It's like, I would call it like quite an intimate conference, if that makes sense. So that's something that is available. And like I said, they do an annual conference every year. I don't know if it will stay virtual. It was a conference that was always an in-person conference prior to COVID and now has a virtual component. So I hope that it will continue to have kind of the in-person and virtual elements to it, because I think that just makes it so much more accessible to teachers. But I don't know what they're going to do moving forwards. Healthy Dancer Canada also does webinars and online things like that as well. So again, you can get on their email list, or their membership is quite inexpensive. So it is an organization you might consider becoming a member of, because then again, some of the webinars and things like that are free if you're a member, and then just have a fee associated with them if you're not a member. So that would be another organization to just be in the know and kind of keep an eye out, because they do have events that sort of happen periodically throughout the year. Another organization that has a lot of continuing education opportunities is the Harkness Center for Dance Injuries. They're based in New York City, and they actually provide healthcare services to the dance industry and to performing artists. But they have a branch of like the Harkness Center is dance medicine continuing education. I'm not 100% sure. I haven't checked into their programs a ton recently, but they previously ran in-person courses that, again, they'd have sort of like a 2-day fundamentals of dance medicine course that was like an in-person course. I'm not sure if they're still running that course in person. I know a lot of their stuff is available online as well, but they have a huge variety of things that vary from more comprehensive, like introductory to dance medicine courses, and then also just little like modules and kind of like online trainings and things that you can access as well. They also do some online stuff for other parts of the dance community. Like I know sometimes they do these little like coffee chats that are more designed for dance parents or like dance educators, and it'll just be like a topic once a month or whatever it is, and they'll do like an online kind of like a Zoom room type thing. So they have a lot of different things to check out. If you're looking for something specific in terms of, oh, I really want to learn about like the hip, or I really want to learn about like one specific kind of like body part or anatomical area, I would definitely check out their library, because they have, like I said, like these kind of continuing education modules that are online, and a lot of them are like really specific to one thing like that. So if you're just looking for more information, say you're like, I've had so many dancers that have had foot injuries recently, I want to learn more about like how the foot functions, check them out, because you can probably find information or just like a little mini course or a module on specific things like that. So that is the Harkness Center for Dance Injuries. And like I said, I will link it all in the show notes. Another option is the Ballet blog. This, I always think their name maybe should have evolved. It doesn't really tell you everything that it is that they do. So some of you may be familiar with Lisa Howell. She's a physiotherapist down in Australia who's been doing education courses for years and years and years, and her programs are fantastic, but it's so much more than just ballet. So she does a lot of courses that are very much just based in like, again, the fundamentals of like dancer health and wellness and dance medicine. And she has lots of different levels of her courses now. A lot of what she has is looking at just like, the whole body and sort of like different assessment and treatment techniques for the bodies. Originally, I think her courses started out specifically for healthcare practitioners, I believe. Oh, maybe I'm backwards. Maybe it started for teachers. Anyway, she now has a lot of teachers and healthcare practitioners who participate in her courses. They're really like in-depth from an anatomical perspective. If you're really interested in like learning more about like anatomy and applied biomechanics, her courses are great for that type of thing. And then she also has, kind of more specialty modules. So she has things specifically on like the foot or specifically on turnout or things like that. So like I said, don't be thrown off by the name, the Ballet blog. Like if you are like, well, I don't teach ballet, I'm not a ballet teacher, I teach acro or whatever. Don't be thrown off by the name. Her courses are so much more than that. I think she just started as a blog, and then it kind of evolved into this, and then the name just hasn't changed. But absolutely super comprehensive, like lots of information in terms of dance medicine type courses. Along that same realm, in terms of dance medicine type courses, there is DMEI, which is the Dance Medicine Education Initiative. And again, they have courses that are kind of like fundamentally looking at assessment type techniques for dancers. I think these courses are definitely geared more towards healthcare practitioners who, and movement practitioners. So it doesn't have to be like a licensed healthcare practitioner, but if you're a yoga teacher, if you're a Pilates teacher, if you're a physio, things like that, and you're interested in learning more about specifically working with dancers, these courses are geared towards that. And again, they're set up kind of in modules. So they have a fundamentals course, and then they have different modules like on top of that are more specifically lower extremity or upper extremity or that. They are in-person courses, as far as I know. I am not 100% sure if DMEI has online components. They do. kind of one-off specialized things where they might like look at, I don't know, turns, for instance, like pirouettes or things like that. And those definitely are offered online. But in terms of their fundamental course, I'm not 100% sure if there's online options for that, but there's definitely in-person options. So that's just something to consider if you are looking for, more specifically kind of dance medicine or, transitioning from working maybe more with general population into, okay, what do I need to know if I'm working specifically with dancers? So that is a list of a bunch of different examples. Like I said, my list is absolutely not exhaustive. There is so much other stuff out there. And if you are listening to this and you have any like favorite courses or recommendations for courses that you've taken that you're like, this course was incredible, other dance teachers or other healthcare practitioners absolutely should take this course or be aware of this course, send them in to me and I will do a little update on this. I'll either do it as like a blog post or maybe even a second podcast episode with other kind of crowdsourced recommendations. Because like I said, there's lots of other stuff out there, and especially stuff from other parts of the world. Like this is very kind of North American focused, although the ballet blog, like Lisa's in Australia, but for the most part, this is more North American focused. And I know there's tons of stuff out there like in Europe and other places. So please, please, please send me in all the other suggestions and I will compile those for you guys as well, because I think the more resources that teachers have available and healthcare practitioners have available to them, the better off the dance industry is. The other thing that I will also kind of just mention super briefly is there's a lot of we'll call them like expos, I think. So there's like the Dance Teacher Web Expo, or I guess they're conferences sort of, but almost more like conventions, but for dance teachers, if that makes sense. And those can be amazing ways too of going for, 2 days, 3 days, whatever the duration is, and learning a ton of different information from a ton of different people. So those are becoming more popular. And I think a lot of teachers are sort of seeing the value in doing something like that, as opposed to having to travel all over the country to take different courses on different weekends. So those are options for continuing education as well. And they're starting to maybe include a little bit more in the dance medicine and dance science realm, although traditionally they've definitely been more dance teacher focused in terms of more teaching techniques and classroom management and pedagogy and things like that. So just worth mentioning that those types of events also exist depending on how you like to consume your continuing education. But like I said, not an exhaustive list at all. If you have other suggestions, please send them my way. I will absolutely share them with everybody because, like I said, I just think the more people are aware of what's out there and the more teachers can continue to invest in themselves and invest in their teachers and keep their teaching practices current, the better off the dance industry is as a whole. As always, if you have any questions about any of that stuff, please feel free to reach out to me. And otherwise, I hope you have a fabulous rest of your day. Thank you so much for listening. I really appreciate your support and have a great day.